This case is of a stent-assisted coiling of a complex anterior communicating artery aneurysm using the Neuroform Atlas stent. Here we explore a 67-year-old female who was admitted to the emergency room after cardiac arrest secondary to atrial fibrillation. After resuscitation and under stable conditions, a CTA and MRI were obtained to evaluate stroke or ischemia. While there were no signs of ischemia, a complex anterior communicating artery aneurysm was found. After discussions with the family and after a peer review conference, it was decided to consider stent-assisted coiling for this complex anterior communicating artery aneurysm. Here you can see the angiogram showing a multilobulated, broad-based anterior communicating artery aneurysm. This is seen both on CTA, diagnostic angiogram, and high-resolution, three-dimensional rotational spin of the diagnostic angiogram, showing multiple lobes. Evaluating the aneurysm under 3D reconstructions, we can see this is irregularly shaped with multiple lobes and a relatively broad base with one of the anterior cerebral artery branches coming out of the base of the aneurysm. Here you can see the microwire accessing the A1 from the right side. We're bringing the microcatheter up and then bringing the wire across the anterior communicating artery. After multiple attempts trying to cross the anterior communicating artery, we obtain bilateral femoral access, and we're going to approach the aneurysm and the anterior communicating artery from the contralateral side. Here we can see bilateral injections, and here once again we see the microwire accessing the left anterior cerebral artery in the A1 segment. Here we're going to go across the anterior communicating artery into the contralateral A2. You can see the microcatheter being tracked over the microwire, and now the microcatheter is in the A1 segment. Once we have firm purchase in the A1 segment, the wire then is navigated across the anterior communicating artery into the contralateral A2 segment and up the A2 segment of the right anterior cerebral artery. Here we can see very distal purchase of the microcatheter. Next, we come back from the right side and we're going to attempt to access the aneurysm. As the wire is navigated into the A1 segment on the right side, we carefully navigate the microcatheter along the wire, as can be shown here. Typically, we may shut off the flush so we can develop friction between the wire and the microcatheter and use a push-pull technique, and as we pull the wire, we can drag the microcatheter up along the wire into the A1 segment. Once the catheter approaches the aneurysm, we then use a microwire to access the aneurysm and place the catheter in the aneurysm. Once the catheter is stable and in the aneurysm, here you can see we're bringing up the stent, but we don't deploy the stent. Another technique is to keep the stent in the catheter so we don't move the contralateral microcatheter, and once the stent is in place but not deployed, bring the microcatheter into the aneurysm and begin deploying the first coil. Once the first coil is deployed but not detached, we now return to the left side microcatheter and unsheath the Neuroform Atlas stent. Here under high resolution microangiography, you can see the stent being deployed. Slowly we unsheath the Neuroform Atlas, try to optimize the position, and now we begin to deploy it across the neck of the anterior communicating artery aneurysm. Again, we see the coil is in the aneurysm, but it is not deployed. Once the stent is completely deployed and we're satisfied with the positioning, we remove the contralateral microcatheter, specifically the left microcatheter, and turn our attention to the right microcatheter and begin deploying coils. As you can see, we're deploying coils liberally in the aneurysm, trying to maintain the catheter in the aneurysm, which is jailed. To clarify, we used a jailing technique where we brought the catheter into the aneurysm while the stent was in place in another microcatheter but not deployed. Here you can see we continue to coil the aneurysm to our satisfaction, and once we feel it's satisfactorily coiled, we will remove this microcatheter. Also, to recap, the stent spans a left to right configuration, with the stent beginning in the left A1 segment and ending in the right A2 segment, spanning the anterior communicating artery. This concludes this case of stent-assisted coiling for an anterior communicating artery aneurysm.